So one thing we've talked a lot about the patients here. How good do you think caregivers are at identifying off? And do we discuss it adequately enough with them at the visit?
So I always turn and ask my caregivers, not my caregiver, but the patient's caregiver, can you see and tell when the patient's medication is working or not? Because to me, what they observe, and if they can observe, it means that the patient is having off, which are really much more than a patient having a non-motor off or a slight motor symptom, so to speak. So to me, the caregiver is very important in this situation.
Yeah, we have to educate patients, families, caregivers, because patients feel what they feel, but they can't see what their families and caregivers see.
Right.
And we really have to have this full education to make patients aware that we may be able to improve these symptoms by adjusting medications.
Do any of you keep symptom lists or anything like that in the waiting room for the patients and the caregivers to take a look at?
Like a diary, you mean?
Diary or a list of motor and non-motor symptoms that the patient's experiencing, so they can check them, so you make sure that's discussed.
We do, and we use it for the structuring the visit. All the questions that I might ask are there filled out in advance, but the form can go home also to guide people to what is Parkinsonism and not arthritic symptoms or why you're sleepy during the day necessarily. But you bring up an important point. In clinical trials, we use the home diary, the Hauser diary, on and off, and we have to instruct the patient what is off and on. And we return to these questions with the patient, but unfortunately, off is the full range of Parkinsonism. It's not captured by that diary. The data you read about drugs and how they work and how much off-time improvement is really just a shadow of what is really going on in the patient's experience. And we have the opportunity of email feedback from patients or patients mailing back things by snail mail, whatever it is, to give us a change and then its translation into clinical effect, because the next steps might not wait until 6 months or 8 months for the next visit. And so one of the things I want to bring up is how often should patients be seen when they have the motor fluctuation problem, when they're not optimally controlled in the eyes of the treating physician, when the caregiver has a disparity with what the patient's saying. What's that feedback? What's that continuing interaction?
So the question is, how often should the patient be seen, or how often we can see the patient?
Or interact with them, even if we don't see them, given the context that somebody has motor fluctuations, has off time, has suboptimal control.
I mean, ideally, it should be every few weeks, not few months. The challenge at times becomes is if you are doing electronic communication, it can be difficult to get the same feedback as opposed to a patient sitting in your clinic and explaining it, because just because a patient is having off doesn't mean that it is affecting them, or that means it is necessarily needs to be treated, because off could be just a little, let's say a thumb tremor, versus an off could be where a patient cannot get up and walk during that time period. So I think there's a whole spectrum of off, and just because a patient is having off time doesn't mean that we have to be necessarily aggressive about it. But at the same time, if the intensity of off is worse or is disabling, then yeah, I think we should try to reduce or eliminate the off as much as we can.